Jeff, over to you.
Okay, thank you, Ting, and welcome everybody. Thanks for coming tonight. My name is Jeff Michelson, and I am one of the steering members of the NYPAN Single Payer Committee. NYPAN is from, I see a lot of people I recognize tonight, but there might be a few new people. And for those of you who might not be familiar with NYPAN, it's a statewide organization with about 30 chapters supporting progressive candidates and progressive policies in New York State. And this single payer committee is designed really for one purpose: to get a particular piece of legislation passed, which is the New York Health Act. That's the bill before the New York State Legislature that would create a single payer healthcare system for all residents and full-time workers in the state of New York. So that's guaranteed comprehensive healthcare for everyone. And by comprehensive, it really is more comprehensive than any plan that exists really anywhere. It would cover everything, including long-term care, which is a pretty key component. So yeah, I think with that, before we get it, and tonight, by the way, we have a great lineup. We're going to be hearing from Yuling Koh Hsu, who is one of the co-directors of the Campaign for New York Health, which is the statewide coalition of groups working on this issue to get the New York Health Act passed. But before we get to that part of the program, Ting, would you like to go over the community agreements?
I would love to.
Great.
In a manner of speaking. Okay, I'm going to share my screen. Okay. I'm going to have, Emily, can you let people in while I'm doing this, please, if you can? Okay, so it's pretty simple. Basically, we're trying to assume best intentions, but challenge each other's thoughts, not each other as people. Step up and step back is important. If you've been somebody who has not been stepping up, feel free to step up, say something, speak your mind. On the other hand, if you find yourself talking a lot, try and step back and let other folks have some time. Consider why you're talking. Does it add something to the conversation? That's important. We try and be efficient about this and get everybody out on time, and part of that is not repeating ourselves. And finally, time yourself. You'll have 2 minutes, and I will be strict about that. All right, back to you, Jeff.
Great. So yeah, so as I mentioned earlier, the main thing on our agenda tonight is to hear from Yuling, who, as I mentioned, is one of the co-directors of the Campaign for New York Health, also just an amazing activist and an amazing person. We're really lucky to have her here tonight. And she's going to tell us a little bit about what the broader campaign has in mind strategically and tactically over the coming months to push this bill past the finish line. And with that, I think I'll hand it over to you, Yuling. Thanks for joining us.
Jeff, thanks, Ting. Hey, everybody. Very nice to see a lot of you I haven't seen in a while, and some new faces for me. I love when there's new faces and I don't know everybody. So to go over a little bit of, I guess, the landscape, and this will include some of our priorities and kind of messaging for the next legislative session. One, we're still in a pandemic, still have tremendous long-term effects from it. And of course, how different would the pandemic have been if we already had single payer? It could be a new era with Cuomo gone, right? We have not found any public stance from Hochul yet on single payer exactly. We're attempting to schedule time with her before the end of the year. We do know that she shows interest in many women's rights and health issues that can directly relate to the New York Health Act. We hope that her choice to appoint Dr. Mary Bassett as a New York State Commissioner of the Department of Health shows her values and is not solely an election strategy. Either way, we will maximize Dr. Mary Bassett as much as we can. She is a longtime single payer supporter, both at the state level and nationally. I myself have worked with her through Physicians for a National Health Program, New York Metro, and also through the Poor People's Campaign National Health Justice Committee. 2022 will be the 30-year anniversary, I guess, of the New York Health Act's introduction. And this movement has shifted the narrative, significantly over these past 30 years. And we know that this is not just about passing a bill, it's about building a mass movement. It's about building power, and we go into every year with the possibility and goal to pass the bill. But whether it passes or not, we know the work that we're doing is to build power. And we know that the hard part comes after the bill is passed, right? When we have to defend it and make sure it's implemented without dilution, that it's implemented the way we intended it to. And with elections coming up, both a challenge and or a benefit. We know that candidates running on the New York Health Act beat IDC incumbents, right? All of you in this room helped do that. We helped win a Democratic supermajority. Last year, we made history by introducing the New York Health Act with majority support in both the Assembly and Senate. So we are looking to understand how the elections during the IDC days can translate to the elections coming up now. And I'm sure folks in this room, I would love your insight about how we can maximize electoral work with the New York Health Act. Lots of unprecedented and positive progress continued despite our electeds failing to bring New York Health Act to a vote last session. And here you see a picture on the bottom left of Scott DeNoyer of Saratoga Springs, bird dogging Hasty, Carl Hasty here. He also bird dogged Stuart Cousins at the State Fair in Syracuse in August. And from that, we have NPR and other media interviewing Hasty about, hey, why are all these activists here bird dogging you and harassing you? And so there we have Hasty on public record saying he needs to bring labor to the table and that he will. And the Campaign for New York Health is working more closely with our top labor supporters to strengthen that support at the leadership level. So we're talking NYSNA 1199, Committee of Interns and Residents, and a few others to do very surgical work with them again at the leadership level. And simultaneously, we're working mostly with DSA and NYPAN, some folks in this room, on rank and file organizing, which will be important to be able to really push the levers of power within the unions. And Dick and Gustavo are in conversations with public sector unions, and we are seeing positive progress from those conversations. Major news is that Stuart Cousins has created work groups on the New York Health Act. I believe there are 5 at the moment. And we know that when Andrea Stuart Cousins creates work groups for a bill, that bill is considered big and bold and controversial, but it's also considered we also know that when a work group is created, that it's being taken seriously as well. And we saw that with bail reform and the housing justice bills that were passed a few years ago now. So we continue to build business support for the bill as well. I put this here just because it's something that we try to prioritize. We often don't have capacity to prioritize, but it will be important in order to pass the bill and then even after it's passed. So this has been challenging mostly due to capacity. We do have more than 500 business endorsers and new ones trickle in, but we have not enough people to follow up with them, to engage with them beyond signing the petition, right? So we certainly will try to raise funds to hire an organizer that can help with this. And of course, I'm always keeping an eye out for volunteers who are up for this responsibility as well. This next slide is just a small percentage of the logos of all the organizations. There's about 300 or so that endorse the New York Health Act statewide. And so I like to share this slide because it shows the diversity and abundance of support, but I also show this slide today to emphasize that, again, in order to defend and implement the bill, and really even to pass the bill, we need to anchor this work in organizations. As many of you know, the Campaign for New York Health is scrappy. Ursula and I are the only paid staff for the campaign. We were able to fundraise recently to hire a part-time health justice organizer through the end of November, which has been tremendously helpful. Desmond Abrams, you can see him in the top left holding a Buffalo Hearts New York Health Act. And it's also great that he's based in Buffalo because that seems to be a gap for almost every movement, not just ours. So we've had so many victories and so much activity last year. We only hope to ramp it up this year. Last year, we were able to ramp it up an extra notch in the spring, April, May, and June. We had funding from Adi Barkan's organization, Be a Hero. They gave us funding to hire a part-time comms team, and that cost we were lucky to get away with hiring a comms team for $8,000 a month. We only had them for 3 months, but it was pretty crucial to being able to do all the things that we did last year. And they also were able to share staff with us. So for example, be a hero. Folks were able to run the phone banks that we did weekly without Ursula or I having to be there every week. So this slide to say, we passed the bill, health insurance companies are not going to be like, well, we were defeated, I guess that's it. They're just going to tighten their death grip on Albany even more. So that's why we're emphasizing much more that we need to build a mass movement, and that this is bigger than just health policy, right? It's bigger than healthcare accessibility and affordability. It's about dismantling one huge playground of white supremacy and wealth extraction. And passing this bill not only helps with our healthcare, but it helps us reach desegregating our public schools, ending homelessness, alleviating the mental health care crisis, raising the wage and keeping those raised wages in our workers' pockets, right? So what are we doing? There's a lot of simultaneous work happening, a lot of simultaneous strategies. This is the basic overview that this fall through the end of the year, we are focused and prioritizing all of our base building, growing the movement, building leadership, so that when we mobilize in January for a big kickoff welcome back action, as the pandemic allows us and as we see how the next few months pan out in general, just legislatively, but we would love to be in Albany, have a presence in Albany and have a big rally there to show the legislators that we're here. And then January, February, March, as always, sucked up by budget legislation, which the New York Health Act is not part of the budget legislation until after we pass it. So the way that we stay relevant, one of the ways we stay relevant is that we generally will have a Go Bold platform, and that'll be the things that we've done before, right? Coverage for all, more intermediate incremental things, but important things. So coverage for all, for immigrant healthcare, protecting Medicaid, ending medical debt billing, and other things like that. And that way that allows us, like legislators won't have meetings with us about the New York Health Act during the budget season. So it's good for us to have this platform, not only because those priorities and protecting Medicaid is important, but it also allows us to schedule meetings with legislators and be able to throw in the New York Health Act with that, with those conversations. In April is when we want to have a big action, right? Last year we had it on June 7th, which is a little bit late, but still very useful. So we want to try and do something like that June 7th mobilization in Albany in April, this next session. And then April, May, and June, we push and have really high frequency activities and ways to stay in the media almost every week. Last session, we were able to stay in the media almost every week, not every week. So this time we're hoping every week at least once. You can see here that we prioritize target regions, and this is based on discussions with various legislators, including Gustavo and Dick, and also many of our statewide partner organizations. And I won't list them here. You can see them, and I'll give them for Ting to put in the notes too. So I will skip over this. It's just a quick reminder where our strategy is rooted. And so we have a whole slew of trainings coming up: storytelling, bird dogging, Twitter, letters to the editor, a whole bunch of advocacy trainings. They started October 4th. The last one happens November 22nd. We are focused on participants from our target regions, though everyone's welcome. This is just to say that we've seen the trainings work really well to build leadership in our folks, but also to create content, right? To push out and amplify how important the New York Health Act is. And usually, so for example, with the dancers at the top and the farmers at the bottom, we had a New York Health Act 101. We had a storytelling training just with those organizations, and ended with homework for them to write out a 2-minute healthcare story, come back to a 1-hour recording session a week later, and then we were able to launch their stories, whether individually or quote graphics or data graphics, or with the farmers, for example, we did a montage video that you might have seen. And I'll skip some of this. Again, I'll share the dates with Ting so that they're in the notes. So some of the important things that are coming up: grassroots organizing call Tuesday, October 26th. We're going to try to make it a bit more interactive and have breakout groups. Thursday, October 28th is the day of action. We chose Thursday, October 28th because the first week of November is when SOMOS happens. And that's basically when all of the kind of nonprofit advocacy groups get together with legislators, and they're having it in Puerto Rico this year. It happens every year. And it's just like a whole lot of networking and schmoozing. So we want the New York Health Act to be on the minds of legislators and their staff, and also of all of our partner organizations and just general public, right? So that it's on the tip of their tongues when they are all schmoozing in Puerto Rico. In fact, I think we'll have a couple people going. I'm trying hard not to go. So that's the call-in day. That's email, tweeting, and calling. We have a week of action, Monday, November 15th through Sunday, the 21st. This is statewide, and we're emphasizing speakouts, rallies, tabling, and canvassing. We would love if each region, even each organization, could organize something. And the goals of this is, one, yes, to show off the statewide movement, to have content for the movement, to take over the phone, social media, and email that entire week, have so much activity statewide that we get the attention of the press. But the primary goal is to get people out and about so that we build leadership, right? It's an opportunity to have the supporters in this group, an opportunity to build leadership by participating in the planning of the events, gaining new supporters. And all of this prepares for when we have, mobilizations in January and April as well. So register to let us know that you want to do something. Reach out to Ursula and I to let us know how we can support you, or if you want to bounce ideas off of us. And we will have, toolkits and materials, and we'll do phone banking and text banking and press releases and things like that to support everyone's actions. Then just a couple more slides, Ting. We are collecting postcard petitions. For example, Northwest Bronx Community and Clergy Coalition has a goal of collecting 1,000 postcard petitions from hasty constituents by January. Now, we aren't dropping postcards off in January, but we plan to do that in April, and we want to have piles of them. Probably a lot of you have seen us do this before. We haven't done it for a few years, and we'd like to do it this April. It's a really great visual to just really dump the pile of postcards on each legislator's desk. And so we hope that NYPAN can set a goal of how many postcards and by when, and then organize those events to get those postcards signed. And two more things. The November 30th, we will have a call-in day. And this one is, we're focused on calling legislators' offices so that staff then gets this influx of calls, right? And tells their legislators, oh, there's all these calls coming in about the New York Health Act. And this is timed because the Democratic Conference, the Democratic senators have their annual retreat. And this year we hear that it's December 2nd and 3rd. So this is right before that. Again, to keep it on the tips, on their minds when they meet and decide what their priorities are. And then just to plant the seed, we don't have details yet. And often those details we can't really figure out till the week or two before. But we intend to be in Albany and have a presence for kind of a quote unquote welcome back, time to get to work rally. So that's the end of my spiel. Let's talk.
That's awesome. Thank you, Yuling, for that. And yeah, maybe we can open it up to some questions. If you have a question for Yuling, you can put that, why don't you just put your name, put Stack in the chat. And maybe to kick that off while people are thinking if they'd like to ask you a question, you went over some of the stuff that NYPAN could get involved with. It seems like the next big thing that we could participate in with the statewide campaign would be the week of action in November. So since we have chapters all over the state, that have their own capacity, in addition to the people who are involved directly with the committee, what are some examples of things that they could do in their home districts during that week to participate?
Thank you. Yeah. So for example, Rochester is going to have a press conference. They're deciding whether or not if it's going to be legislator heavy or if it'll be focused on mental health and the New York Health Act or unions and the New York Health Act, things like that. So it can, that's one great way to get attention and also involve the different players, right? Legislators, union members, nurses, home care workers, things like that. I think that's really useful. That can be very intensive though. Something like canvassing, even just organizing a canvassing, I think is actually where my heart sits. It might not be media attention exactly, unless lots of areas are doing it, which so far, we do have a lot of areas that want to do canvassing events, but I think it is actually one of the most important things to do right now in preparation for the 2022 legislative session. And I know that there's folks like Earl, Earl's already been doing a lot of canvassing and postcard petition collecting, and other folks as well in this room. So that's something that I think is really good, and it helps people practice also to like get out there and have conversations with people about the New York Health Act, and then like have that practice of like, oh, these are the weird questions that I don't know. I realize I don't know how to answer when I'm having a personal conversation. So organizing a canvassing, even if it's just for like 2 hours on a Saturday or something like that. The press conference and a speak out, I think, is really nice because that also is a way for you to think about, okay, who are the people that we want to organize with, that we want to show up at this speak out and or rally. Organizations, individual testifiers sharing their story. You could involve legislators if you want as well. So it can, yeah, that also involves the different players as much as you can, but it really makes you think about like, okay, who should be showing up here and who should be speaking.
Excellent. And yeah, presumably the canvassing could also involve the postcards, right? That's a great thing to do when you canvass is collect postcards.
Yeah, absolutely.
You have more of those we could hand out, by the way?
Yeah, I was just going to ask.
So for materials, it's been a little tricky because the NYSNA office in New York City is very limited access. And they've been going through some changes. So anyways, all that to say that we hope by the end of, or by the week of action in November, we hope to be able to send everyone materials like we have in the past, right? So that you don't have to take on the cost, or so that we don't have to do reimbursements and things like that. So yes, we hope to have materials for you by the week of action.
Great. Excellent. That's all the questions I have. Anyone else want to ask Yuling a question while we have her? You could just raise your hand if you'd like.
I see in the chat, yes, I can share the slide deck. I can put it in the chat in a little bit, or give it to Ting. And oh, thanks, Ting. Yeah. And then I have a question. What should we be asking other legislators besides Hasty and Stewart-Cousins? So the other legislators are important, and we're, I think I didn't mention, we're also prioritizing marginal legislators. And by that, I mean legislators who won by a slim margin, right? So we're talking mostly upstate legislators, Hudson Valley and upstate legislators. And we have that list. We'll have a public whip list out again. It hasn't been updated since last session, but we'll have that out for you so you can see kind of the tiers, the priority target list. So those legislators are important as well, especially if you're not a Hasty or Stewart-Cousins constituent, right? Because we know that Hasty and Stewart-Cousins, well, at least Stewart-Cousins anyway, listens to her colleagues, right? She's not going to do something that her colleagues don't want to do. So that's why it's important to both reach Stewart-Cousins, but also make sure that her colleagues, your legislators, are also talking to her about the New York Health Act.
Great. I see one more from Debbie. Is there any thinking about strategic priorities on the message beyond that we need the New York Health Act?
Yes. I might need more elaboration on that question.
Yeah, Debbie, do you want to just elaborate?
Sure. I mean, the great presentation you just did seemed mostly focused on the methods of reaching people and who to reach and the events and the tactics, but not so much about what we're trying to say beyond the fact that we, want legislators to support the New York Health Act. We need this, and maybe the particular emphasis on business. So just wondered if there's any thinking at this point about strategy on the angles about the content.
I'm sorry I don't have a good answer to that. The short answer is yes. And then there's particular messaging depending on what angle you're going for, right? Because there's so many reasons why we want to pass this. So maybe Debbie, you and I can talk about that one-on-one.
Sure. I'd be happy
to have an example.
One example of something I think maybe has been underplayed in the past and might be useful to highlight, since we're in a period, even though we're in a period where the number of totally uninsured people has gone up, but a lot of the time, this whole kind of issue gets played as, we need universal health insurance, meaning everybody should be covered. And there are important pieces about, covering undocumented immigrants and so on. But for most of the population, the unifying issue is dealing with underinsurance and the fact that people have gaps in their coverage. And so maybe there's a way to make a sort of strategic message that almost everybody is underinsured. Did you realize? That's one example.
Okay, thank you.
So probably
Yeah,
just,
yes.
I'm sorry, did you have anything you wanted to add to that?
No, go ahead.
Okay, great. Probably just have time for one more question. I see a couple about information, Susan, that we can track down for you, but maybe we can move to Earl's question. I guess it's a strategic question. Are we trying to get volunteers out to reach Hochul? Are we focusing on the governor at this point?
Thank you. Not focusing on the governor, though. Whenever she tweets out about healthcare things or women's rights, or we can relate the New York Health Act to almost everything. She recently tweeted out about World Mental Health Day, for example. It is, I think, useful to get our whole coalition to retweet her quote and say like, hey, pass New York Health, XYZ, why it's connected. We will eventually have a call-in day to Hochul's office, but it just hasn't been determined, I guess, strategic yet. Not to say that any of you in this room shouldn't call her on your own. We just aren't planning a huge call-in day yet until a better moment.
Okay, great. And actually, I'm going to add one more, and this is similar to what Susan's asking in the chat. I was intrigued by the news that there are working groups. Now active working groups. Can you elaborate on those a little bit and tell us, like, you said there are 5 of them. Are they on different subjects or with different groups of people, or how does that work?
So I hate that I can't, there's a lot of information I can't share, but so there are 5 groups. They are on different topics. So the topics, for example, these are not necessarily real, but it's like, cost, doctors, implementation, or like labor, things like that. There is not a timeline yet. And we've seen work groups work as quick as 3 months, but usually apparently they work at least 6 months. For the New York Health Act, because it seems to be something so unique to legislation, we don't know what it'll look like.
Okay, well, it seems positive. I've heard similar things, that the working group is often a step in that direction. So like, I'll take it as a good sign.
Yeah, or I guess I'll explain that the work groups, they're really meant to, they're really meant for the different sides to come together and have lengthy, 5-7 hour conversations to really get into the nitty-gritty of the bill and get past, like in Senate conference, they conference for just a few hours, and the New York Health Act is just like one small piece of the long agenda for when they conference during the year. And so they can never, all they can get to is like, well, we think it's going to cost a lot. What about all the people who lose their jobs? And they can never get to like the answers of like, well, we've thought about this and this is how we're handling it, right? So the work group is really meant to dig into all of that and come to consensus.
Excellent. Okay. Well, thank you so much for joining us. You're
Gene
welcome
has
to
his
stick.
hand up. I don't know if you got time for one more.
Yeah, sure. Why not? Gene, do you want to ask a question?
You're muted, Gene.
While Gene's finding the mute button, I'll just say, I think you all know how to reach me. I'll put my email in the chat. You have a great group here of very knowledgeable folks. And I will try to look at the chat and see if I can answer any of those questions. Thanks.
Yeah, I just wanted to ask, does the assembly operate the same way with working groups?
They do not.
Okay.
So the assembly does not have a work group.
All
Okay,
righty. And with
thanks.
that, we better get on to the rest of our agenda. Thank you so much, Yuling. Take
I
care.
really appreciate it. Thanks a lot.
Yeah. Okay, great. So that was a lot of good information for us, and I think a lot of it actionable stuff that we can start working on right away in our working groups. By the way, I didn't mention at the beginning of the meeting, and for those of you that might be at your first meeting of the single payer committee, we have 5 working groups ourselves, working on different aspects of the campaign. We have an electoral group. We have a person-to-person group that works on outreach, canvassing, and that kind of thing. We have a group focused on outreach to doctors. We have a labor group working on that aspect of it, encouraging more labor unions to come on board with the bill. And we have a research group doing some of the background research that we need to provide the information that others can go out and share with legislators and with the public. So if you'd like to get involved in any of those working groups, please sign up for one. That's really where we get into our nitty-gritty of getting the work done that we want to do to get this bill passed. And that's actually a good lead in to what we're going to talk about next, which are a couple of tactics that we can, we want to focus on in each meeting on a couple things that we can actually do, either as a committee or with our individual chapters. Ideally, both, but I'd say, if anything, more emphasis on the latter. All of these things are things that can be done in your own districts with your chapters. And in particular, I just want to talk about one thing that we've been developing with the Campaign for New York Health for about a year now, which is a program called the District Leader Program. It's basically a way to identify a person or maybe in some cases 2 or maybe even 3, but no more than that, in each legislative district in the state, starting with the key ones, but ideally in all of them, who can be a point person for organizing lobby visits with the electeds, for if necessary, putting pressure on those electeds through canvassing, phone banking, whatnot. And anything going on in that district, the campaign's been trying to identify those point people, and then have them coordinate on a state level, so they're sharing information and tactics and so on. And it's a pretty well organized program at this point. And if anyone on the call tonight is interested and think you might have the capacity to do that, I'm going to put a link in the chat where you can get some more information on it and check it out. And if it sounds like something you can and are willing to do, please sign up. Like I said, we'd love to have the whole state covered. And it really is a great way to both, coordinate on a global level with the whole state, but also really focus in individual districts with the people who know them best. So if you're interested, please sign up. And then I think we had one other tactic we wanted to feature tonight, which is Donald, I think, is going to tell us about.
Right. Thanks, Steve. I represent the medical professionals group, the doctors group, and I'm on a terrific team with Susan Beckley from upstate, and Dr. Steve Auerbach and Betsy Rosenthal from PNHP, and a number of other people. And we've got a strategy of getting out to the providers, whether in hospitals or doctor practices, medical practices, because if we can get those folks to understand the act, and they don't, get them knowledgeable in the act, they can then become advocates for us. So one of the first things we've done in our tactic is to put together a provider letter. I just put the link in the chat, but it's also a hot link in the agenda. And that's meant to be a letter for providers from pro-Health Act providers. So the first thing we're thinking of doing is just getting this letter out to all of us who can carry these letters to our own doctors. When we visit a doctor, try to get 2 minutes at the end of an encounter to explain the act and say that there's more and more to come, and then get out to the business manager, the admin manager out in front, and try to talk it up and leave a copy of the letter with them. So feel free to take the letter. We have to still put signature block on the letter. We haven't finished doing that yet, but I'll make that available once we have it. And it'll likely be from the team, which includes an actual doctor, which is a good thing. So the summary here is just getting out in front of the providers, helping them learn about the Act, do away with any misconceptions about the Act, and there are plenty of them out there, and get them as advocates for us. So that's the message. And given the time, I think I'll stop here. Any questions?
Okay, great. Thanks, Donald. Yeah, any
Thanks.
questions?
Thanks. Sign up.
Excellent. Great. So I think next Ting is going to tell us about the new flyer. Whoop.
I just want to point out that in the chat, somebody wrote down that you need permission to access the letter, and I just went in and tried to access it, and it says permission.
Donald will give you
required.
permission once he gets off.
Okay.
He's busy at the moment.
I just have a quick question. When we're organizing it, is it by legislative groups? Do you mean the Senate or the Assembly?
I think that's a question for you, Donald.
No, actually, it's for you. I
I'm
didn't
sorry.
get my question in. I put it in the chat, but
Got it.
so you were
yeah.
talking. Yeah.
So either,
Oh.
in some cases, we have some people who are doing both their assembly person and their senator, but if you'd like to do one or the other, that's great too. In some ways it's better if it's the latter, because if you can just focus on one person and really get to know, what makes them tick and, what's going to get them either on board with the bill or to be more supportive, then that's the ideal. So yeah, either Assembly and Senate, big picture, for years, it's the picture has been that, the Assembly, it's passing the bill, but the Senate is blocking it. That was always a little bit misleading. I mean, the reason that it had passed the Assembly so many years was that they knew it wouldn't pass in the Senate. And so I think it's really key for us to be working on legislators in both houses. So, if, for example, in your district, one or the other better, then and you're interested in the program, I would sign up for that person.
Okay.
Great. Excellent. Okay, let's move on to the flyer. Ting, I think you're going to tell us about that.
All righty. Yep. I'm sorry Naomi's not here because her team has done a tremendous job working out this new flyer. We actually are printing them. They'll be ready in about the next day or two because of the holidays. Things got slowed down. We printed 2,500 of them, and we'll make them available to anybody who wants them. There's a web form which will go out in the email after this, and people are going to send them out to you however many you want. So let's take a quick look. What we did was we decided to do it single-sided English only to avoid that whole problem of having double-sided, the cost, plus you have to have a separate one for every language. To solve that, though, what we did was we incorporated a QR code right up here on top that says Espanol, if you can see it. So when you're talking to somebody, if you simply scan that, or they can scan it with their phone, it brings up a page on which we have a list of all the flyer languages that we have available. And they can click whichever one they want. They'll see the same flyer in whatever language they choose. That's not quite there yet because we're waiting on the Spanish one, but which will be the most common one probably, but we hope to have that up in the next few days. So the idea of using the form, though, is to get people to sign up for our volunteer army. And we're getting people doing that, by the way. But this bottom QR code here is the one that does that. It brings them right to a form. It's very simple. They can sign up. And it goes right into our database, and we'll follow up with them. And follow up is a whole other thing that we're looking for people to do because we have more people signing up than we can actually effectively follow up with them. And so one of the things that would be good, and there'll be an ask in the email that follows this meeting, would be to see if you can be a person who could do that either by email or phone. In some cases, we don't have the phone, but in any case, the idea is to be a kind of mentor to the person, bring them in, get them fired up, get more information if we don't have it, like we don't have their phone. It'd be nice to get their phone so we can text them or whatever, and help them get involved in being a volunteer. So any questions about that? I'm real excited about it. and we're having good effectiveness. Thanks, Sue. Okay, back to what's our next regularly scheduled?
Okay, great. I think we're going to do updates from the working groups now. Maybe Ting, would you like to kick us off with the electoral group?
Yeah, actually, we're having our meeting tomorrow, so it's a little premature, unfortunately. But we are slogging through it, I guess you would say. It's since there's no actual election to work on at the moment, other than India Walton and Buffalo, and anybody who wants to go, I would love to help get you up there. But as far as the Health Act goes, nothing at the moment. So what we're trying to do is build out essentially a statewide bird dogging effort on all the senators who need to be bird dogged. And that's going pretty slowly, unfortunately, and I wish I had better news, but it's a little hard to do. It's relatively easy for me to say, oh, I know, I'll go see my senator. And doing it once is not that hard, but then continuing it is what's hard. So we need to find better ways to do that, I think, and if anybody has ideas or best practices they've used, I'd love to hear them. But we want to keep it top of mind for them between now and beginning of session. And then we'll switch into a different mode for getting ready for the June primaries.
Got it. Okay,
that's it for us.
Thanks, Ting. Donald, would you like to go next?
Sorry. I think the provider letter is the sort of tip of the iceberg, and but that's the thing that we're most focused on right now. But working off of a model that Susan Beckley has created up for upstate, we're trying to get in front of groups of providers in practice management groups and hospital groups. She's had some real success at getting started. We're getting a list. We've got actually a list from Dr. Steve Auerbach of students, med students who are in their residency, who are getting prepared to enter the field, and we're going to try to reach out to them. Both Dr. Steve and Betsy Rosenthal attended the PNHP annual conference last weekend, 2 weekends ago. So we're trying to follow up with them to see if they reached any contacts that they can provide. And for the moment, that's it. We're focused absolutely on providers. We're focused on getting pro-Health Act providers to take on the job of getting in front of their colleagues. I know it's a big job, but I think we're up to it. So that's the message for now. Thanks, Jeff.
Great, thank you, Donald. And I just want to highlight something Yuling said in chat in response to Ting's question, that there is a bird dogging training coming up on the 18th of October. So you should sign up for that. And we'll be including links to those trainings when we send out the notes. I don't see, well, Naomi's not here tonight. So unless somebody else from her working group wants to give a report, I think, and Steve, I believe, is not on tonight either. He's the head of the research group. If anybody from either of those groups wants to give a report, maybe raise your hand. But in the meantime, I'll give a quick update on what we've been doing in the labor working group, which is two things really. We've been working on creating materials, outreach materials for union members. And we've pretty much got one done or ready to go and to use. And I just put a link to it in the chat. It's a general flyer that you could give really to any union member, making the case for the New York Health Act, specifically from the perspective of, you know, how good it will be for people who are in unions. And then we're working on other materials that are a little bit more specific in terms of comparing costs and benefits under, union plans compared to how the benefits that you would have under the New York Health Act. So that's one of the things, but we've also been trying to amplify and support the movement really among municipal retirees in their fight against this decision that happened earlier this year to privatize their healthcare benefits. We have a lot of those retirees in our working group. They've been having a number of demonstrations and events around this, which is very much linked to what we're doing, because I won't go into the details of what the city and the Municipal Labor Council have done to privatize the Medicare for their health benefits for these retirees, but it's not good. And it's a perfect demonstration of why we need to move to a single payer system in order to make that kind of thing obsolete, right? So that, benefits can't be bargained away, the next time there's a negotiation. And so we've been supporting those. And later tonight, we're going to have Bob Greenberg tell us briefly about an upcoming event that I think is taking place in the city on Wednesday, one of the demonstrations. So that's what we've been working on. I see Mary's hand up. Would you like to ask a question?
No, I was just going to speak about the person-to-person activities. I don't know if anybody else here is in that group, but unless I missed it, we haven't had a meeting. I don't know where Naomi is, but anyway, I've been doing some cabling, and it's very slow up here in rural Chemung County. Wish I had a subway station where I could just get out to lots of people. But the last time I was tabling at the library, there were two people that stopped by the table. One was a nurse and one was a nursing student. And he suggested hitting the nursing schools to table. And he took almost all my literature to pass out to his friends. So I just thought I'd pass that tip along.
Sounds like a great idea to me. Thanks for sharing that, Mary. Seeing some links in the chat to some of the questions that people had asked about and some of the resources. Ting also gave the information for the demonstration I mentioned that's on Wednesday with the retirees against their the privatization deal. Great. So I think the next thing we were going to do tonight is, and we'll probably have to do this pretty quickly, but give some quick report backs. This is, if anyone that's not on the agenda has been doing something in the last month that they'd like to share, please raise your hand. But we had a couple things that we were aware of. One, I think Sue Abbott Jones is going to tell us about. Sue, I think you had some information about your chapter, what you guys have been up to. Mm-hmm.
Oh, no, I didn't. I must have misunderstood your email.
Oh, okay. I guess I'm just referring to you had decided to start working on the New York Health Act as a chapter.
Oh, yes. In fact, that's the only thing we've decided to prioritize. So that's what we're doing. And we're another progressive group in town, the Voters for Change, Ting knows about them. Some members from that will be joining us. So, and then the hope is it was last year, and now that COVID has lessened up and we can get to the farmers markets have been going, the farmers want to get on to our committee also. So that's where we are.
Fantastic. That's great news. And welcome to the fight. Great. So, and I'll just give one piece of news about what, actually, this wasn't a specific chapter. This was kind of the steering group of the NYPAN Single Payer Committee. We had a meeting with Senator Hinchey. She's up here in the Hudson Valley about the New York Health Act. And it went well. She's already a co-sponsor. We were trying to get her to become a more vocal one and more active, to get her to become a more active supporter, which, I think we're edging toward. And she's definitely engaged in conversations with Dick Gustavo and the rest of the, Dick and Gustavo and the rest of her conference in the Senate on the New York Health Act. She does fall into that category of legislator who has some concerns with the bill, some changes she'd like to see. Hopefully they're working through some of those in these working groups. But we're, one thing we did manage to get her to commit to is holding some kind of public event in the next few months focused on healthcare. And the idea, I think, is going to be to have her listen to her constituents about their healthcare concerns, rather than just, have it be another meeting about the New York Health Act. So that was a good meeting, and hopefully there'll be lots of other lobby meetings that chapters and maybe district leaders, if any of you are signing up for that, will be doing in the coming months. Mary, I see your hand up again.
Yeah, can you tell us what kind of changes that she would like to see?
Sure. Well, she wasn't very specific on that front, I will say, but she has general, I would describe them more as concern, areas of concern. One, and you know, they're very legitimate areas of concern. One is she wants to make sure that the bill has, you know, provisions in it that ensure that people in rural areas will not just have healthcare coverage, but have access to healthcare facilities. That's, you know, she represents a mostly rural area, and it's of course the case that you know, our current system does a terrible job of allocating resources to rural areas and to underserved areas in the city as well. So that's a major concern. She wanted to see more specificity about the kind of long-term care that would be covered. She wanted to see some more details about the structure of the tax brackets. I would, if I had to characterize it in general, she just wants to see more detail. And as she has put it many times, I've met with her a few times, she wants it to be perfect or near perfect, because she thinks, you know, this is our one shot to do it right, and it needs to be as, you know, as good a bill as possible before it reaches the floor. And so hopefully that's not just, you know, delaying it and kicking it down the road, but actually working toward a final version of the bill that she can fully support and get vocal about, and that all of them can, leading into the next legislative session. Yeah, Jerry, I see your hand up.
Yeah, I guess what I'm concerned about is we hear this from a lot of the politicians. I want to know the detail before I go and vote on it. When we know that this is going to evolve later, they're going to, you know, the detail, they're not going to have the total detail. And I feel like they're not being sincere, and it's a way of putting off the commitments.
I agree with you, and I'm on exactly the same page. I will say not everyone in the group that met with her came away with the same impression that I did, which is that maybe she's just trying to kick it down the road and use, you know, a quote unquote perfect bill as an excuse to delay it forever. I don't know that's the case, but I have my worries along those lines, and I have heard that from many other legislators. It's great to say, oh, well, it doesn't have all of the detail that, like you said, is going to be written into the bill in that at least 2-year implementation period after it's passed, that can't be written into the bill at this point. So yeah, I'm wary about that. And I think, you know, as a movement, my personal view is that we don't want to go too far down the road of trying to figure out how to appease every legislator's concerns about the bill. You know, that's what the legislator's job is in the conference and in these working groups. Our job is to keep the pressure on, so they know they can't just delay it forever. They need to keep it going. So, you know, there's a balance there. You don't want to ignore them when they say they have concerns about the bill, but of course, you know, I think we just need to keep it moving forward as activists. Bob, see your hand up.
Thanks, Jeff, and great meeting everyone. My name is Bob Lederer, and I'm with PNHP New York Metro, and I wanted to invite all of you to the national conference of PNHP National, which is on Friday, October 22nd and 23rd on Zoom. And there is a modest fee to attend, but you know, I think it should be affordable for many. And there's going to be a lot of good discussion, information, and kind of strategy discussion about how to pass single payer nationally. As far as our local chapter, we're having our next educational forum on Tuesday, November 16th at 7 p.m. And I would, and you can get the details, sorry, on the national meeting at pnhp.org. And for our local meeting on November 16th, we're going to be presenting the results of the, it's actually a retreat, not a conference, that we held last weekend to plan our activities for the coming year. And each working group is going to make a presentation, and we'd love to integrate with the work of NYPAN and other grassroots groups. These working groups will now be open to anyone, whether they're on the board or not. And so I think it'll be both enlightening to all of you as to what we're doing, but also an open place for you to have input in what we could be doing this year and how you might help us achieve that. So and that's pnhpnymetro.org. The details aren't out yet, but hopefully by the end of this week, we'll put them up on the November 16th meeting.
Thanks, Bob. And that's actually a great segue. We're just at 8 o'clock. We do like to end our meetings on time. If we can go just a couple minutes over, just to wrap up with some events coming up. Ting, would you like to start with the Buffalo event, Buffalo, Syracuse, and Rochester?
Yeah, actually, it was more in the nature of a call, but NYPAN and Working Families and a number of other folks are trying to get people to go out to support India Walton, who's a big Health Act supporter, among other things, and who, as most of you hopefully know, won her primary for the mayor of Buffalo, and is now being the same incumbent is working against her with Republican money to try and get her out. So I'm just making, if you have any desire to do that, let me know.
Perfect.
Thanks.
Thank you, Ting. And did you want to quickly just go over the events page?
Yeah, really quickly. We can now use the Campaign for New York Health's events page, which looks. Oh, that's not it. Sorry. Which is great because there's already traffic there. And so if you have events, you're doing your canvassing or whatever you're doing, phone banking, let me know. Because at the moment, I'm the only one from our group who can access the page to put things up, but it's easy to do and I'll be happy to do it.
Awesome. Thanks, Ting. And then last, well, we already talked a little bit about the UFT demonstration coming up. Bob, do you want to just take a moment to describe what that's all about? What's going to happen there?
Okay, I'm not actually clear on.
I'm sorry,
specifics.
not you, Bob.
Oh, so
Bob
sorry.
Greenberg. No, sorry, no worries. There's lots of Bobs in the world, and Bob Greenberg, are you still here? I think you're still muted.
Oh, yes. Yep. Thanks. Thanks, Jeff. On Wednesday, day after tomorrow, the 13th, the UFT Delegate Assembly is meeting, and we have a demonstration really in two major areas. One is to defend our retirees' health plan as we've had it, which is Medicare, and to prevent its privatization, which will go into effect unless we stop it on January 1st. So that's the retirees part. And there's also a movement among in-service teachers and other educational workers because of the conditions that they've had to work under and the lack of concern for their health and lives, as well as the students, in terms of COVID. So we're joining forces, and there will be a resolution placed before the Delegate Assembly. We placed another one in June that was called out of order, but this one, I think it's on, well, we're going to get it out tomorrow, right, Ting? Hopefully?
Yep.
Yes, there'll be an email
yeah.
coming out from NYPAN tomorrow morning.
Okay.
And,
So
Ting also put the link to the flyer, or Jake put the link to the flyer in the chat.
Okay, thanks.
Great. So basically, what it does is it raises the issue, including why has the UFT flipped on being against privatization, and now it's for it, and a major player in the fight against the New York Health Act. So it's a growing movement. We have growing support. There are now three lawsuits against the plan in the courts, and hopefully we can, we don't know how far this can go, but it's growing. Thanks, Jeff.
Fantastic. Thank you for that, Bob. Great. And are there any other announcements before we wrap up tonight?
Could I just add to that?
Yeah, please.
Yeah, so inside this is going to be at 52 Broadway, right? Outside of the Delegate Assembly.
Right.
And inside, there plans to be a resolution brought up in the UFT Delegate Assembly. And they expect it to fail because the Unity Caucus has the votes. So either when it fails or if they refuse to hear the motion, there's planned a walkout of certain number of delegates that are going to go outside and join the rally at that point. And that might be around 5. We don't know the exact time, but it could be around 5:30-ish or 5, or depends, or maybe even a little later, depending on how long the meeting takes.
Right.
Okay.
Thanks, Jake. We're
Sure.
asking people to show up at 4
Right.
and to stay
Yeah, the
till
outside.
6.
Yeah, the
Not
outside.
the
part's
outside,
fine.
the outside group, to show up at 4 and to stay at 6. So we welcome the delegates as a walkout or come out. And there will be leafleting as well. Just talking to delegates, trying to spread the issue. There's a lot of people, a lot of members are just not aware of what's happening. So it's really an informational thing is very important at this point of spreading the word.
That's great. And I see in the
Thanks, Jake.
chat,
Thanks, Jake.
I see in the chat that Dick and Gustavo are confirmed to speak at that event. So that's awesome. Hopefully they'll be able to tie these issues together. Okay, well, I think then we should probably wrap up there. Thank you all for coming tonight. We'll get notes out. I know we threw a lot of information at you pretty quickly tonight, but it'll be in the notes with links. And yeah, thanks. Let's keep this thing going. I love where we're heading as a committee. I love the work you all are doing in between our meetings and the input that you're bringing to these meetings. So thank you all for your commitment and dedication to this. We're gonna win this fight. So with that, I will say good night. Thank you all for coming.
Let's do it.
Yeah, let's do it.